July 2020 is the 30th anniversary of the passage of the Americans with Disabilities Act. Some say it's the most important civil rights legislation since the Civil Rights Act of 1964. And what it meant to do was to enfranchise people with disabilities and maximally integrate them into civil society. Back in 2018, the American Academy of Neurology, American College of Rehabilitation Medicine, and the National Institute of Health concluded a 5-year evidence-based review and wrote guidelines for the care of patients with disorders of consciousness, a group of patients who are characterized by the vegetative state, the minimally conscious state, even coma. And these patients were sort of outside the ken and purview of the ADA when it was written back in 1990. But in the years since the ADA, and really in the last 20 years, we've learned a lot about patients with these disorders of consciousness, most notably patients in the minimally conscious state, patients who are often confused with being in the vegetative state, but these folks have liminal states of consciousness. They're aware, they can feel pain, they can sometimes respond intermittently and episodically. They hear what's in the room. As that famous line from Hamilton says, they're in the room when it happens. I'm Joseph J. Finns from Weill Cornell Medical College and Yale Law School, and I'm delighted to present an article with my colleagues, Megan Wright from Penn State University Law School and School of Medicine, and Samuel Bagenstos from the University of Michigan School of Law. We're going to talk about our article, Disorders of Consciousness and Disability Law, which appears in the August issue of the Mayo Clinic Proceedings. And so in the spirit of our 30th anniversary of the Americans with Disabilities Act, and given new guidelines that came from the AAN, the American College of Rehabilitation Medicine, and the NIH, we're going to talk about what medicine and the law owe these people who are often in the room but unrecognized as being in the room. And with that, I'm going to turn over to my colleague, Professor Wright, to discuss some of the empirical findings related to the neglect of this population in clinical practice and in clinical civil society.
So thank you, Dr. Finns. One of the things that we know from recently published work in Health Affairs last year is that healthcare providers don't actually know their responsibilities to their patients under the Americans with Disabilities Act. When interviewed, they show only a superficial understanding of the Americans with Disabilities Act and evidence a complete misunderstanding of their responsibilities to their patients in terms of accommodating their patients. So one of the things that we do in our article, our forthcoming article in the Mayo Clinic Proceedings, is argue that clinicians not only have a professional responsibility to engage in good clinical practice with their patients with disorders of consciousness following this newly released guideline, but they also have a legal obligation under federal disability law. And with legal duties come legal consequences. And so one of the things that we'd like to see change is that healthcare providers get some sort of education, either in medical school or continuing professional education, about their legal duties to their patients with disabilities. And I'll turn it over to Professor Bagenstos for a description of these responsibilities.
Yeah, so thank you very much. This is incredibly important. In addition to being the 30th anniversary of the ADA, it's the 21st anniversary, so adulthood of a very important Supreme Court decision under the ADA, which is the Olmstead decision. What Olmstead did is it said that the ADA requires, as part of its non-discrimination obligation, that individuals with disabilities be served in the most integrated setting appropriate to their individual needs. And, you know, that was a case that was about a kind of classic deinstitutionalization situation where you had individuals who had developmental disabilities and psychiatric disabilities who didn't need to be in a psychiatric hospital but were there and were seeking to get out. But through the years, in the 21 years since the Olmstead decision, the courts have made clear that this is a very general principle of integration where a healthcare system can provide people supports to be more engaged with their families, their communities, with other people with and without disabilities, that there is an obligation under disability discrimination law to do that. So now that we know that there are people who have been perhaps erroneously diagnosed as being in a vegetative state when they have minimal consciousness, who can, with supports, engage with folks around them. It is the obligation of healthcare providers and healthcare systems to provide supports to make that happen.
Thank you, Megan. Thank you, Sam. And thank you for reading our article. We hope it is meaningful for you and, more importantly, meaningful for patients with disorders of consciousness. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.